With less than 2 months now until the end of his term, President Biden this week is rolling out a new plan that would require coverage of weight loss drugs for patients on Medicare and Medicaid. That could help potentially some 7 million Americans pay for the expensive drugs. But there's a catch. Because of some federal rule timing, it'll be up to the Trump administration to actually carry this thing out. Question is, will they? NBC's Maggie Vespa has more in our Sunday Focus.
In a nation where more than 40% of its adult population, 100 million people, battle obesity, a potentially game-changing push in accessing popular weight loss drugs, with a new proposal by the Biden administration this week that would require Medicare and Medicaid government health care for older Americans and those in need to cover Ozempic, Wegovy, Zepbound, and similar meds by reclassifying them as treatment for a chronic disease, aka obesity itself.
Weight loss.
For so long,
I felt stuck.
Currently, Medicare and Medicaid only cover the drugs for patients who are diabetic or have certain obesity-related conditions.
The idea that obesity is a chronic disease is broadly accepted now in the medical community.
Larry Levitt is the executive vice president for health policy at KFF, a nonprofit that researches health policy issues.
I think the biggest impediment here is going to be the debate within the Trump administration.
We want every child in America to grow up and to live a long and healthy life.
The proposal, announced Tuesday, requires a 60-day public comment period before taking effect, leaving the final word up to the incoming Trump administration.
I've known him for so long. For the past 16 months, Robert F. Kennedy Jr.
Trump's Health and Human Services Secretary pick, Robert F. Kennedy Jr., has publicly blasted the medications.
Giving good food, 3 meals a day, to every man, woman, and child in our country, we could solve the obesity and diabetes epidemic overnight.
Dr. Oz.
While Dr. Mehmet Oz, who's been tapped to run the Centers for Medicare and Medicaid, has praised them.
If you want to lose weight, I should support you in every way possible. And I think these new generation of medications afford us a huge opportunity.
And I'm keeping the weight off.
A key factor in the looming debate, cost. If approved, the White House estimates the new rule would dramatically cut out-of-pocket costs for more than 7 million Americans, with weight loss drugs currently clocking in around $1,000 or more per month. The tab would instead be covered by taxpayers, costing the federal government a combined $36 billion over 10 years, and states roughly $3.8 billion, according to officials who added they don't expect premiums will rise.
What's your take on how likely this rule is to become a reality?
You know, I haven't met anyone who can reliably predict what President Trump will do on any issue. And frankly, coverage of obesity drugs would be very popular for seniors. President Trump has said he doesn't want to cut Medicare. This is an opportunity to improve Medicare.
A critical limbo period for millions of Americans struggling to access these life-changing drugs.
Maggie is joining us now from Chicago. Maggie, good morning. And let's say that this rule does actually go through. A lot more Americans have private insurance, and most of those plans also do not cover these drugs. So how would this affect them?
Yeah, Hallie, exactly. So it wouldn't affect them directly, at least not right away. But experts point out that private insurers often follow Medicare and Medicaid's lead in expanding coverage in cases like this. So we'll see how that goes. Meanwhile, the cost of these drugs is also back in the spotlight, with Senator Bernie Sanders writing, quote, unless Medicare demands that drug makers Novo Nordisk and Eli Lilly substantially reduce the prices, Medicare premiums for all seniors would skyrocket. And earlier this year, the CEO of Novo Nordisk told lawmakers they're working to bring costs down, but also blamed the, quote, complex U.S. healthcare system. And then, Hallie, one final note, we reached out to Robert F. Kennedy Jr. and Dr. Oz's teams about this proposed rule. And so far, we have not gotten a response. Hallie.
Maggie Vespa, thank you very much. Appreciate that.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.